common themes. It's interesting, like parents ask us commonly, what kind of multivitamin, and I'll get back to that. How do you get rid of autoimmune disorders? Remind me if I get distracted again, but bring me back. But so the question gets asked, like, what kind of, I have a healthy child. What kind of multivitamin should I give my child? Sometimes I'll like roll my eyes a little bit and I say, well, it's definitely not, Flintstones or Centrum. and if it's a family that I sense is just kind of starting on their journey, they're like just kind of getting into functional or integrative health, I might suggest Animal Parade, something that at least doesn't have artificial colors, flavors, and sweeteners like those other ones do. But if it's a family starting to get into it a little bit deeper, I'll say we're really kind of getting away from multivitamins and starting to get a little bit more focused for that. So for most of our patients, I think most of you could probably tell this, what I'm going to say here. I'm preaching to the choir a little bit, but the top 3 recommendations that we have probably 80% of our practice on now, I think, maybe 75, are probiotics. That's a whole other topic. We can talk about those in a minute. I'd be happy to drill deeper into that, and fermented foods. Omega-3s, and vitamin D3.
Is the omega-3s, is that the cod liver oil?
That's our favorite one, particularly in winter.
And because my son is 8 months, when should because I gave all that stuff to my daughter, and she's like really, really healthy, and so I want to kind of do the same thing for him. But I don't remember, of course, when I started, and I did like rice chaga and all that kind of
really?
stuff. Yeah.
And
so I don't know what age I can start him. Right now I'm doing probiotics and vitamin D, when I can start him on the other stuff.
Okay, so the question, I have to start remembering to repeat questions too, because I'm not sure our weapon here is going to pick up every sound in behind it. But so the question is, at what age to start cod liver oil, or and then maybe the other question that was even before that in queue was, why are you recommending omega-3 supplements, and then which ones do you recommend, and then at what age to start? So let's take all 3 of those. There's actually a pretty good section on this on our website too, in our common concerns. We have a whole page of frequently asked questions about omega-3s. Why do we recommend them? Well, a couple reasons. One is because when we actually can do blood tests for them, which started about 2 years ago, everyone was talking about omega-3s for years, but it was very frustrating because Quest and LabCorp, where 95% of our patients go, didn't have a test for that. But now they do, and insurance covers it. And should all children have their omega-3 levels checked? Probably, or their omega-3 level 6 ratio checked. I check mine. I think my kids have had theirs, but not a bad. I mean, if you had to do a blood test, throw in omega-3. Like for years, like when we started doing vitamin D levels 10 years ago or 8 years ago, it's like you're going for a lead test, get a vitamin D in there too, because that's a very high yield test. 80% of our patients are low, and with omega-3s, it's not that high. Maybe 40 to 50%, 40% are low. And more recently, I'm finding about 5% are too high. Like we have, I'm not going to name names, but we have a family that the parents own a health food store, and they have unlimited access to every omega-3 out there, and I never saw such high omega-3 levels before. So you can't take too much. So why do we take them is because they have a lot of kids are low, and they have so many health benefits. They are good for autoimmune. Getting back to your question, one of the best way to get rid of autoimmune disorders is to optimize your omega-3, omega-6 level, and to take probiotics and vitamin D3. That's kind of really
answering it. What are the dosages that are recommended for all 3?
Sure. So with omega-3s, my general recommendation is cod liver oil in winter, fish oil in the summer. It's a pretty soft recommendation. It's just that so you get some variety. You see which works better for your kitty. Cod liver oil has vitamin D and A, which it's kind of a traditional, like, you think about a Scandinavian seaport in, or, a child that's growing up in Iceland. What are they going to, how does an Eskimo not get vitamin D deficient in the winter? Well, probably in part of it's because they stoke up, they get 16-hour days in the summer, but fish and fish oil, cod liver oil particularly, has a pretty good amount of vitamin D, so that's probably what prevents them from getting rickets. Now, once you get but there's variations on that. Children have a speech delay, for instance. We kind of like Speak, SPEAK, or Speak Smooth, it's also called, which it's a emulsified, kind of expensive form of fish oil. It has a lot of vitamin K, vitamin E in it. I like that. Tracy Simonton, who's a pediatric nutritionist in town, is big on Barlean's fish oil. It's more palatable. Primarily we recommend Carlson's and Nordic Naturals. And then for teenagers, anyone can swallow a pill. We like krill oil. That's what I take. Usually for our vegan patients or kids that have really severe seafood allergies, we have a bunch of those. And they can be problematic because once they become allergic to seafood, their omega-3 intake is going to get even lower. Where are they going to get them? So it's like these kids with eczema that have seafood anaphylaxis, they get like a death spiral. Their skin gets drier and drier. Their allergies get worse and worse because they get more and more omega-3 deficient until just recently when algae oil became available. So we have a few kids, either because the families, for ethical reasons, doesn't want to consume fish or because of allergies. And we have a few families that seem to get by with plant-based omega-3s, but it's a little dicey. Your plant-based omega-3s, which are not DHA or EPA, those are ALA, and that's like omega-3 you derive from flax, chia, hemp seed, maybe purslane. But you have to be able to have the enzymes to convert that into DHA and EPA for your brain and nervous system to use. And so finally, to get back to your other question, which was the dose. What's the dose of fish oil for a 8-month-old? Well, and then what age to start it at? I think I generally wait till a year of age on the average to start fish oil for a few reasons. One is if it goes down the wrong pipe, it's bad news. If a child chokes on a hydrocarbon or like a fatty substance, gets into the lungs, it can create a lot of inflammation. There's a thing called hydrocarbon pneumonia. I don't know if that happens with fish oil, but I don't want to find out the hard way. But if we have a child that maybe, so I'd much rather have a nursing mom take a ton of it, which it should get into her milk,
So,
not be an
and
issue.
I am nursing, so I should, I guess, be taking krill oil, you think?
Yeah.
Okay. You don't know the doses offhand, right? I mean, I could look at the bottle or whatever.
Well, I take 1,000 milligrams a day, and I'm not breastfeeding anyone. I think for your,
Okay.
and I eat wild salmon once every week, once every 2 weeks.
Yeah, I usually have, I
yeah.
have fish like once or twice a week,
I used to eat tilapia, but I'm kind of getting away from that.
Yeah.
It's
Not supposed to be
affordable.
the
My
good
kids like it,
outfit.
but it's like, yeah, farmed fish is bad news.
Yeah.
Yeah.
Vitamin D3, what's a good dosage for kids this age?
D3, yeah, that's a good, really important question. The general recommendations are, this is pretty rough, 400 units per day, first year of life, 1,000 units a day from age 2 to 3.
That's 1,000 IUs?
Yeah, so D3, there's two different forms of vitamin D out there. There's D2, which is like, if you get asked for a prescription for vitamin D, it used to be that we could only prescribe synthetic vitamin D, which is called ergocalciferol, which was nice because if you're on Medicaid, you couldn't afford even $5 a month for vitamin D3, which works a little better. Then we could still write for D2, or like you have some families that we have them here at Bambini that have just the mindset that if a doctor's writing a prescription for it, it's a good it's that's what I want for it's a sign of quality, and I don't know. So 400, 1,000, 2,000 for kids in elementary school, kindergarten through 5th grade. Once you get into high school, to approach adult size, maybe 4,000 for a young lady, 5,000 for a young man. Those are all ballparks. A lot of factors involved. African Americans need a little bit more, for instance.
How about me at like breastfeeding? I give him 400.
That's fine.
And then I take like 800. Should I up that, I guess?
Yeah, unless you know you're sufficient or you're planning a trip to Cancun. That's
I
the
wish.
best way to get it. Or do indoor tanning. You can do that too if it's like, but or do both. But for a lactating mother in winter, when flu is in town, and vitamin D protects against the flu, protects against RSV, protects against mold allergies. Every week there's another study on vitamin D. It protects against depression, bipolar.
Cancer.
5,000 a minimum while you're nursing.
Wow, okay.
And if you haven't been on it and you don't have time to get a blood level done, do 10,000 until you get a blood level. There's just so many health benefits to it.
And what about, because, I don't know, my coworker was saying the other day, you gotta be careful because it's fat soluble, you could overdose or
Yes.
whatever. And but it's fine, like, you have to take a ton to.
You have to take a ton. I
Yeah,
think in the last, since we started Bambini 7 years ago, we've tested, maybe 2,000. I've seen 2,000 vitamin D levels across the desk. And those 2,000 levels, like I said, 75-80% of them are low. 24% were sufficient, and 1% are too high. The highest, so what's an optimal vitamin D level? Vitamin 20. So the blood test you should ask for in case you don't get it done here. You get your primary, or you try to. Here in New York, I think the other 49 states in the country you can order your own blood work right there. But you can go to directlabs.com or something. Life Extension, there's all kinds of ways in the other 49 states to get your own vitamin D tested. You sort it yourself. You go get here. You can't do it here, but you have to get a 25 hydroxy level done in it. The lab range for LabCorp requests, they'll say it's 30 to 100 is the average, but 50 to 80 is considered optimal. The highest I've seen is 225. A couple children that, I don't know if the stopper was loose or something on the bottle, but they had no symptoms at all. It was just on part of routine child care. It was like they were going for these. I think these were two kids actually that live in New York, in Brooklyn, that were getting their care up here. And parents were giving them vitamin D. Said, let's get a vitamin D level just for grins, and level was like 225.
Wow.
Had them stop, and we checked their calcium, phosphorus levels, and a couple other things just to be extra sure, and they were okay. So it's possible to overdose. You're right on. There's 4 fat-soluble vitamins. There's vitamin D. There's vitamin A. I know about that one. My mom gave me vitamin A poisoning, I'm told, when I was little, but I'm still here to talk to you about it.
Oh, jeez.
And that's a tough one to diagnose. I have to give my pediatrician credit for knowing that the symptoms were I think they had something to do with having red hands and feet or something. I don't remember. I've never seen vitamin A poisoning, and then vitamin E, I've never seen that, but I think it's possible to get that, but you'd have to take a lot of vitamin E. And vitamin K, so those are the 4 fat-soluble vitamins, A, D, E, and K. And in my whole career, I've seen, some high vitamin D levels, and we rarely check kids for those other vitamin levels, but, maybe in a child with cystic fibrosis, we would look for fat-soluble vitamin levels, looking mostly for deficiencies, though. All right, I think I went